Sports Science and Physical Competence Development for the Hockey Squad for 2020-2021 for Hunter Academy of Sport. The topics for this presentation: what does strength and conditioning actually do? The movement performance pyramid, functional abilities for hockey, hockey-specific movements, why is strength and conditioning so important, and injury management process. So just a quick bit of information as to my role with the Hunter Academy of Sport. I'm a strength and conditioning coach and exercise physiologist, and basically my role with the Hunter Academy of Sport is to develop and prepare athletes to go from a regional level to a state level. So it's a large space, a large gap between the performance initiative, and the idea is to prepare athletes using education, assessment and training to get them from that regional level to those state programs. What does strength and conditioning training actually do? So one key thing that strength and conditioning actually does is the initial stage. What we want to look at is the development and assessment process. So the first thing we want to do with an athlete is assess their readiness to train. So to ask the question, can they perform basic movements they need in the correct way for their sport? So whether it's running, jumping, swimming, throwing, changing directions, stopping, all those key functions, we need to assess how ready you are to put up with the rigors of training. The next big question is, can you recover from one session to the next? So a lot of younger athletes have natural talent and a lot of ability, but the idea is to be able to train often to get better and improve over time. You need to be able to recover and recover well from one session to the next, whether that be speed or hockey-specific skill or strength and conditioning or running endurance training. Level 2 there is we talk about the assessment of movement capability. So once we assess their readiness to train, we need to assess their ability to actually get through the training and competition and performance as well. So the ability to endure and exert force. Can they absorb force? So when you change direction, you have to absorb force and slow yourself down and decelerate before you then accelerate. Can you hold form under load? So when you're moving really quick or jumping and landing or changing direction, do you lose form through the knees and ankles and hips? Are you stable enough to be able to put up with the Ks and the volume that you may have to run? So we look at things like muscular strength and endurance, plyometric ability, velocity, power, endurance, even stability under fatigue. Can you put up with the rigors of work to be able to get through the training? The movement performance pyramid, essentially what we look at when we assess athletes is there's 3 essential levels. So the first thing we want to have a look at is, are athletes mobile and flexible enough to perform all the key movements that they need to be able to complete for their sport? So assuming mobility and flexibility are essentially interchangeable terms, if we're looking in the orange initially, the one thing we have to look at initially is joint mobility. Is there any joint mobility problems? So your joints, are they flexible enough? Then we look at soft tissue extensibility, so the muscles and the tendons, are they flexible enough? And even the nerves, upper body and lower body neural flexibility may even be a concern that we may have to check and test as well. The next thing, once we make sure an athlete is mobile enough, we have to make sure they're stable enough. So we look at their proprioception and balance. Now that may be upper body or lower body. Usually for running sport athletes, it's lower body movements. We have to make sure their body awareness and their coordination is efficient, so their motor control and movement patterns are effective as well. And having a look at how you maintain position under load. So being a running sport, we're very interested to see how you maintain hip position and core and trunk position, even when you're on one leg, so squatting and jumping and landing. Those things are important too. So once we get through the initial mobility and we then check stability as well, we then get into the functional movement work. So doing the strength and power, speed, agility, reaction, endurance, all that stuff to train and get better and get faster and improve your movement for your sport. So looking at functional abilities for hockey, the first one, we want to make sure an athlete has minimal valgus loading. Now basically what that refers to is the way that your leg makes contact with the ground. So if you look at the diagram on the left there, you'll see there's person A and person B. The person B there has what's called a valgus loading pattern. So the thigh, your upper leg there, your thigh where the quads are, actually have internal rotation. So it's a lack of stability in the hip. And in the foot, you can see there, the foot's actually turned in, the arch is flattened out, so there's a lack of control and mobility at the ankle as well. So usually what we want to do with this sort of person is we want to increase stability and proprioception at the hip and increase flexibility at the ankle, but it may also be a number of foot control type exercises to make sure the person has a nice arch with their foot as well. So the next thing with functional ability for hockey is to make sure that an athlete who has to produce load and force through the hips has enough effective hip flexor range. So your hip flexors, if you look at the picture in the middle there, the hip flexors, so the psoas muscle attaches to your spine, which then connects through to the iliacus muscle, which are both hip flexor muscles. Now, if they're too tight, what can actually happen is it can limit your hip extension. So your glutes and your hamstrings, they produce hip extension and produce power through the hips. If the hip flexor muscles are too tight, your hip extensor muscles can't produce a lot of force and can't produce a lot of power. So what you'll tend to do is actually use your lower back, particularly in sports where you have to extend hips, where you're running, and where you have to rotate through the trunk as well. So you'll overuse your back, lose power through the hips. So two things we want to try and avoid and check for readiness to try to get around. Now, the next one with functional ability for hockey is to make sure an athlete has sufficient thoracic extension and sufficient thoracic rotation. So your thoracic spine is the middle part of your spine, the lower part is the lumbar, the upper part's the cervical. So we're going to focus on the middle part, the thoracic part. It produces the side bending, the flexion and extension, and the rotation. So if that extension is not there, it's very hard to be able to rotate properly. So in a sport where you have to rotate to produce power to swing a stick, like in tennis where you have to swing a racket, in golf where you have to swing a club, any sport where you have to produce rotation through the trunk, you want to make sure you first have enough mobility and then you have stability and then strength and power. So one big thing we want to check is to make sure extension range is there and thoracic rotation range is there as well. So the next area we want to look at with functionality for hockey is to make sure the shoulder and the pelvic regions have good proprioception and stability. So making sure that your trunk position is in the most appropriate position to transfer load through the body and to support the spine the best way. So if you look at the fella in the white shirt on the left, you can see there, he looks like a pretty muscly dude, but essentially his form through the trunk is very poor. So even though you might have a lot of muscle bulk and be able to produce a lot of force in some ways, if that particular person had to produce rotation stability and rotation power, it probably wouldn't be in the most efficient and best way and would probably overload the lower back. So if you look at the pictures in the middle there of the blue sort of diagram, man, you can see the picture in the middle there has a nice straight spine. The picture on the left has a posterior pelvic tilt. The picture on the right has an anterior posterior tilt. So we want to have the most appropriate posture to essentially produce the most appropriate force and transfer load through the body the best way. So once we actually get stuck into training, the idea is when we first come into the gym is to understand what we're going to do and what we're going to emphasize. So you can think of the body in terms of individual muscles, as in the quads and the glutes and the hamstrings and the calves and the pecs. But ideally, a better way to think of it in terms of a sporting point of view is rather than thinking of training individual muscles, we look at muscles in groups. So we look at them as movements. So a one-leg type action might be a lunging action. A jumping action may be squatting. If you're pulling things towards the body, it's more a pulling function. If you're pushing things away, more a pushing function. If you're rotating, so rotating your trunk or rotating arms, more a rotation or twisting movement. And if you have to support a position, so a lot of core stability type movements or hip stability type movements, it's more a stabilization function. So any sport we can basically relate in terms of these movement patterns, and we exaggerate them or emphasize them in certain ways for different sports. So if we were to consider the specific movements for a hockey athlete, the area I might look at first would be shoulder and trunk and hip and ankle mobility. So really important that those areas have enough flexibility and mobility. Hip hinging and to extend the hips properly. So making sure you have enough range in the hip flexors and that you can actually extend through the hips to produce power through the backside and the pelvis as well. The third one, making sure you have enough rotational stability. So then we can make a good stable spine, a very strong spine, and then able to produce a lot of power and speed as well. And the fourth area, leg strength, specifically one leg power. So initially when we start training, we work on training two legs, but we want to move very quickly as soon as someone's stable enough to get onto one leg specific patterns like running and stepping and leaping and jumping. So also looking at that, making sure that we're training deceleration as well as acceleration. Most athletes are quite good at accelerating and speeding up quick, but not always good at decelerating. So making sure we have enough ability in slowing down so we can change direction efficiently. So if we're factoring in all this previous information, we then ask the question, why is strength conditioning training so important? Essentially what it does, in a very basic way, is it allows the athlete to move more efficiently for your sport. So when you move more efficiently, sporting movements become easier. You can move further and with more force and less fatigue before receiving injury. So it also teaches your body to manage training. So you can bear more bear more load under the same level of fatigue and with less effort. So you can basically do more without trying as hard, and you can recover faster and maximize your improvements and adaptations from training. So in a nutshell, what it does is it promotes athleticism. A more athletic person for a sport moves more efficiently for their sport. So what I thought I'd do with this presentation as well is include a little bit of information on injury management. So how and when to use strapping and ankle guards, a sport where it's commonly there's ankle injuries and ankle sprains. An important thing is to make sure you use guards and taping and strapping at the right times. Not too much, but not too little. Essentially, if you have your guards or you use some strapping if you've had an ankle injury, to use them in games, potentially, you wouldn't want to use them all the time. If you're recovering from an injury, then yes, in the short term, if you've had advice from a sports science person or particularly a physiotherapist or someone controlling your rehab program, after injury before full rehab, then some guards and strapping may be useful, but we have to try and steer away from overusing joint aids, so guards and strapping. Over time, what they'll actually do is decrease your flexibility and decrease your reactive ability, so your proprioception through that area. So it can actually increase your chance of getting injured if you tape and use guards too much. Now, if you want to use them as a bit of a safety net in a game, potentially that mightn't be a bad idea, but you want to spend some time with them off training, doing all normal movements as well. So proprioception, or balance at the ankle, the body's ability to sense the relative position of neighboring parts and rectify body position when placed in a dangerous position. So your ankles and all joints of the body, particularly though when you're running your ankles, need to be really responsive and reactive and control the position of the joints above the ankle. So excessive strapping decreases that proprioception, or using excessive guards over time, which does not allow you to react effectively enough to minimize injury. So the last little area to consider if we're doing rehab, methods for decreasing injury potential, particularly if you have running issues, poor range through the ankle, or if you've had injuries in the past, particularly ankle type injuries. Reactive strength and endurance, making sure that you can balance exceptionally well on one foot, making sure you have enough range through the ankles as well, and making sure your reactive ability and your responsiveness is quite high. So how to rehab? Athlete must rehabilitate the ankle and have effective stability, proprioception, and soft tissue length. Have a stable hip to control the leg and have effective lunging pattern and dynamic posture with enough strength and endurance to do it multiple times to be able to do it repetitively. So the use of stretch tape may be an effective alternative. So stretchy tape is the one, not the rigid tape that you usually have, but some stretchy tape in the later stages of rehabilitation might be a bad idea. It may help as an alternative to stabilize and promote effective movement as a progression from rigid tape and ankle braces and things like that as well.